What is the role of evidence in public health? How do you know if a problem in public health is important? What kind of evidence do you need to demonstrate a problem is important? And how does biostatistics provide this evidence for research in public health? What are the objectives for today? We want to list several of the ways that biostatistics can provide the evidence necessary for public health research and practice. We want to justify the importance of a particular public health problem on the basis of an evaluation of the evidence. When you see a QR code such as the image on the right, you can take out any smartphone, open your camera, and point it at this QR code, and it will take you directly to this presentation. So what can biostatistics do? Biostatistics can look at associations, changes, can use biostatistics to target our resources and to compare populations. Let's look at associations. Biostatistics can help find associations between exposures and outcomes. That's the most common general way to phrase epidemiological research: who's been exposed and who has the outcome of interest. We can look at treatment interventions and disease changes. This is very common in clinical trials. We can look at comorbidities. Those are people who have a primary illness, but also have additional illnesses. So if you look at somebody with multiple sclerosis, they may also have diabetes. They may also have mental health comorbidities. So people can have more than one disease at a time, and biostatistics can be used to look at the associations between single comorbidities, multiple comorbidities, and the primary disease outcomes. We can look at change in physical activities and how that impacts the body. We can look at changes in personal behaviors and how that impacts diseases. So smoking cessation is a very good example. And that leads us to our first example about tobacco use and cancer. So 2,679 physicians say Luckies are less irritating. It's toasted. Look at this ad from way, way back in American popular culture that had physicians promoting cigarettes. Another ad talks about the throat-tested cigarette. So again, we're promoting smoking, that it has shown that scientific research has at last enabled Philip Morris to replace personal opinion with this scientific fact. Cigarettes have proved by actual tests on the human throat measurably and definitively milder than ordinary cigarettes. So this was another ad from long ago that touted the positive effects of smoking cigarettes. And finally, a third one. Not one single case of throat irritation due to smoking Camels. So it wasn't a single manufacturer, it was multiple. And again, showing a physician promoting that you can start your own Camel mildness test today. So to promote smoking. But of course, all of these ads are about immediate issues. So maybe it doesn't bother your throat, but at the time, there wasn't necessarily sufficient scientific evidence to look at more severe outcomes associated with smoking. So finally, in 1950, there was a study done that selected cases and compared them to those with and without cancer. So we looked at smokers, yes and no, and we looked at people with lung cancer and without lung cancer, and examined whether or not they were smokers. So what kind of study is this? We conditioned on the fact that they had cancer, and we looked retrospectively as to whether or not they were a smoker. What kind of issues are there with this? So think about some of the issues that arise from conditioning on the outcome and then looking backwards to see for the exposure. Here again, you could look at per capita cigarette consumption in 1930 on the x-axis. And on our y-axis, we have lung cancer rates in the 1950s. So attempting to make a time association here, looking at what the consumption was in 1930, and then what was the cancer rate in that same area by 1950. And this was on the basis of 7,000 studies done in 1964. And ultimately, the Surgeon General here finally declared that tobacco use is associated with cancer among both men and women. So it took an accumulation of evidence to show a public health threat or an association between smoking and lung cancer. What about changes that we can see? Biostatistics are used to track changes over time. The prior study looking at 1930s smoking per capita and 1950s outcome is a singular association measuring two different time periods, but it wasn't necessarily in the same people. Biostatistics can help you track things called longitudinal studies, and time does not have to be long. It can be short periods of time, long periods of time. It can be in people, it can be in communities, it can be in entire populations. So again, let's take a look at tobacco use. What do you think is the current prevalence of tobacco use in U.S. adults? So when we ask what is the prevalence of tobacco use in U.S. adults, it's really asking how many people are current smokers. Do you think it's 5%, 10%, 15%, or 20%? It turns out, according to the CDC in 2018, we had 14%. And you can see that this has declined since 2005 from 20%, just under 21%, to 15.5% in 2016, and was updated again to 14% in 2018. Cigarette smoking is down, but still that means that almost 38 million adults still current smokers. And it remains high among certain groups. Remember, we talked about targeting or identifying populations, and this is one of the ways that biostatistics can help with public health. So we know that men smoke more. We know that adults 25 to 64 smoke more. Those with lower education are more likely to smoke. Those below poverty level are more likely to smoke. Those in the Midwest and South, where tobacco is grown, are more likely to smoke. In 1965, the year after the Surgeon General's report, 42% of American adults smoked. It took almost 20 years to cut that in half into the 20%. And now, with vaping, it might not decrease as much as we would like. So, tracking changes over time is one of the ways that biostatistics can provide evidence towards public health research. Let's take a look specifically how we can target specific populations for interventions towards public health improvement. Biostatistics can focus on specific results, as we saw in the prior infographic. Where should we focus our efforts to reduce tobacco use? And should we target specific groups for tobacco cessation? Let's take again a look at smoking prevalence. How does Alabama's smoking prevalence compare to the United States? Is it higher? Is it similar? Or is it lower? Well, we know already from the prior infographic, according to the CDC, that smoking is higher in the Midwest and the South. But does that also mean that Alabama's smoking prevalence is higher compared to the rest of the United States? In taking a look at this map of the United States, we can see the key on the right has the prevalence of smoking by state. Darker colors in the purple range indicate higher prevalence of smoking, and lighter colors in the middle down to darker colors in the green with the lowest prevalence of smoking. So if you take a look at California and Utah have the lowest prevalence of smokers. We're looking at light shades of green and light shades of purple and some sort of neutral states in the middle. Lower in Texas, Florida, but we can now see through Missouri, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Kentucky, West Virginia, Ohio, Indiana, Michigan, Pennsylvania, and South Carolina, we're looking at higher prevalence. So while Alabama does not have the darkest shade of purple, it is not the highest prevalence of smoking in the United States, it is higher than the general United States of America. And so if you were implementing smoking cessation programs or any public health interventions, you could then target the areas that have higher prevalence. It may not be fiscally responsible for your organization to target Utah or California. You may have better resources spent in different areas, and that's where biostatistics can help. So what about comparing different populations? We recently just looked at Alabama compared to the rest of the United States. That's at a large comparison level, on a state level, on a population level. Biostatistics can help compare the impact of interventions, so pre-post. What did it look like before the intervention? What happened after the intervention? And biostatistics can also help compare differences in very specific groups of people, say by male or female, by young or old, and at very large levels of comparisons to find differences like Alabama versus the rest of the United States, or the United States compared to other areas of the world. And we can do this for all sorts of public health problems. Let's take a look at smoking attributed deaths. So what causes the most deaths in the United States? Is it cancer? Is it smoking? Is it motor vehicle accidents? Are they cardiovascular in nature? Or substance abuse? It turns out that smoking attributable deaths can actually include respiratory illness, cardiovascular disease, diabetes, lung disease, cancers, and other comorbidities. In 2009, this showed that considering all smoking attributable deaths, smoking actually had more deaths attributed to individuals in both sexes than all other individual causes. Of course, times have changed. It would be an interesting exercise to go look at the pre-COVID cause of deaths versus post-COVID cause of deaths. In summary, biostatistics provides evidence in 4 ways: associations, changes, where to target or focus the resources, and making comparisons between different groups for an associated public health issue. In looking at our essential questions, how do you know if a problem in public health is important? This can take time, or it can be an acute issue. It can be an accumulation of evidence, such as smoking, or it can be acute issues such as a pandemic. You do need evidence, though. And what kind of evidence do you need to demonstrate that a problem is important? It's generally how impactful the problem is, and that can be measured in any number of ways, as we'll see throughout the course of the semester. And how does biostatistics provide this evidence? As we've seen, biostatistics provides evidence towards association, changes, targeting resources, and comparing specific populations.